I am a clinical neuropsychologist, as Carol nicely stated. I've been at the Mayo Clinic in Jacksonville since '99, and before that I was at the Mayo Clinic in Rochester. And I am one of those people who does the tests and puts your loved ones through hours of questions about memory and attention, and it's not as bad usually as it seems to the family member. Usually the patient doesn't mind so much. I'm also very focused on research, trying to understand this disease, trying to differentiate it from Alzheimer's disease in particular. As Dr. Barnea nicely described, Alzheimer's disease is the #1 cause of dementia. It affects about 80% of patients who have neurodegenerative disease. Lewy body dementia now we know affects about 25%. Second most common cause of neurodegenerative dementia. So it's much more common than we once thought. Well, what I wanted to talk about today was some of the behavioral challenges that are specific to Lewy body dementia. I wanted to start out by just setting the scene. I'd like you to imagine that you're walking down a well-worn path by a river. Oh, you're sweet, thanks. There are, the sun's out, the birds are chirping, the sky is blue, it's absolutely gorgeous. This is a path you've walked along for many, many times, many years. But one day you just happened to get distracted and you walked a little too close to the edge, you lost your balance and you toppled over into the river. At first you were kind of shocked, you kind of didn't see it coming and tried to swim to the shore, but then the current kept pulling you back and pulling you in a different direction, and the water got a little rougher, and you actually start to panic because you can't find your way to the side. And that calm, beautiful water became very choppy. The rocks are jutting out, and you start flailing. You're hollering, you're screaming, you're kicking. There's no one around, no one to help you. You feel all alone. You feel like, oh my gosh, this is the end. You figure, well, I'll just try harder. I'll kick harder. I'll move my arms harder. The current is just getting stronger and pulling you back and, in fact, tugging you downstream, and you're getting exhausted. And each attempt to swim to the shore leaves you more and more exhausted, angry, frightened, frustrated. Finally, you remembered something you learned in your childhood swimming lessons. Relax. Float, relax, and go with the current. And in doing so, you realize that you can actually float on top of the water. The rocks are kind of slippery, but they're not as pointy as you thought. You look at the sky and you say, oh, it is a beautiful sky. See the rolling hills, and you realize, wow, the trees are kind of interesting from this vantage point, and the water's not that cold, and it's not that bad. It's not great. I don't want to stay here forever, but it's actually not so horrible. There are some pieces of enjoyment that I can get out of this terrible situation. Eventually, you reach a point where the water's calm, you're able to get to the side, and you swim to shore, and you sit on the side of the river, and you reflect. What you realized was when you fought and tried to do something very rigidly, you weren't very successful, and you spent all your energy, and you just got exhausted and angry and frustrated. But by going with the current, going with the flow, you just had a different perspective and even appreciated some of the things that you may have taken for granted or maybe just not noticed before, like the weather or the trees. By going with the flow, you avoided disaster and you were able to cope with this terrible, terrible situation. And such is the nature of the caregiver's journey. Caregivers, often experience a lot of panic, a lot of fear, a lot of emotions, disappointment, grief. And the reason why I brought this up is because going with the flow, just that perspective can help. It can help you cope. It's not going to cure the situation, but it can help you get through it. And we often feel that we're all alone, but when you are alone, if you try to go with it, then I think you will find that there are little elements that can help you. Oops. And this is Friedrich Lewy, who Dr. Barnea described earlier, and he was born 60 years after the death of Sir James Parkinson. Sir James Parkinson was the person who first described Parkinson's disease, the shaking palsy. He described it as the stiffness, slowness, shuffling, balance problems, tremor. And in 1912, Lewy looked at some brains and discovered these little proteins that were inside the brain cells. And they were then later actually called Lewy bodies to honor him. And these are the infamous Lewy bodies. What I want you to look at is those round, on the top left where it says SN, that stands for substantia nigra, and that's the brain region that's important for movement. And those round balls that are pink, those are what we call classic Lewy bodies. Ah, beautiful. So these things there, that's a classic Lewy body. That's what Lewy first discovered. And for years, this was the kind of stain that was used. And you couldn't see the Lewy bodies in the other parts of the brain with the stain very well. But in 1961, there was two cases reported by Okazaki. And he identified two patients who actually had Lewy bodies in other parts of the brain, and they had other features. They had dementia, they hallucinated, and it was then realized that these Lewy bodies can occur not only in the brainstem, where motor function is important, but also in other areas of the brain where other abilities are important. In 1990, we learned that there are other proteins mixed. There are some proteins mixed in, one of which is a protein called ubiquitin. And then in 1997, a fantastic discovery was made. The very first genetic cause of Parkinson's disease was discovered in an Italian kindred, in an Italian family. And that gene for that particular family, that particular type of Lewy body dementia, was called alpha-synuclein. It was extremely exciting. It really was the most fantastic thing because it was never thought that Parkinson's disease had anything to do with genetics in the past. So now we had this gene, and they got to work, and they discovered that if you stain for this particular type of protein, lo and behold, the Lewy bodies in the other parts of the brain just jump out. And what you see here are these other parts of the brain that have these orangey, dotty things, and then these line things called, those are Lewy neurites. These are Lewy bodies. And these are the Lewy bodies and the Lewy neurites that were almost impossible to view before. This is why, in the last 10 to 15 years, there's been an explosion in our understanding of this disease. Before now, we were, Alzheimer's. Now, we realize that, there's this whole other type of dementia that we were calling Alzheimer's, but really wasn't Alzheimer's. And that's Lewy body dementia. And the reason why we know this is because we went back and we looked at some of the brains that we thought were Alzheimer's patients, but in fact found Lewy bodies, and then we traced back and looked at what their symptoms were and discovered, oh my goodness, they were hallucinating, they had Parkinsonism, very different from what we typically see in normal, or normal Alzheimer's disease.